I thought I would do another update on how I am doing. I have been out of phages for 4 weeks now, to be exact. And the planning was to be out of phages for 2 weeks. So it's a bit long. It's because the communication with the Eliava is a bit hard sometimes, because they are they're far away. So every time you email them, they're 2 to 3 days, go over it, and then you have to email them back, and then you're emailing back and forth, and this takes a little longer than expected. So the result is that I am out of phages for a little bit too long, and I'm starting to notice that. So the first 2.5 weeks were fine. I had no new flare-ups. I had hardly any pain. Pain level was 0. No, hardly any drainage or anything like that. So the first 2.5 weeks were really good. Then, after 2.5 weeks, what I first started to notice was that I was getting extremely tired. Well, everybody knows that with HS, that tiredness is something that can be pretty severe. So I was getting full-blown tiredness. So at first I thought, well, maybe it's my period, because it was around my period time. But it didn't pass. So that was holding on for a few days, and then I got joint pain, which I always had when I had HS, but had none whatsoever while being on phage therapy. So I was like, okay, I have joint pain again, I'm tired, what is going on? It's probably because I'm not taking many phages. Then I got the nausea and the pain in my stomach, things that I also get like a lot of times when I have HS flare-ups. And then there came the flare-ups. So there were a few in a row. They were mildly painful, maximum 6 in pain. Not as painful as they used to be, but they were there. They were really inflamed, hot to the touch. Some were draining. So really HS inflammations, things that I didn't have for weeks. So it was clear that being off my phages for 3 weeks was just too much for my body. So at 3.5 weeks, I started to notice flare-ups again. They are not long period flare-ups. This is different, because normally when I would have a flare-up, they would stay for days, on and off, really painful. The flare-ups I have now are severe as soon as they come up, but they stay for like 1 day. They are very painful, and then the pain goes down again. Some drain, but not that much. So this is a difference. But I would like to be on phages again. So as you know, I sent swabs out to the Eliava. 3 swabs, one of my left armpits, one of my labia, and one of my back. I got the results back. They found 3 different kinds of bacteria in there. So they proposed that I order more intestiphages, more staphylococcus phages, and also do 1 round of PO phages, because one of the bacteria found on my back reacts the best to the PO phages. So I'm gonna get those sent to me. I paid for it, I think weekend before, and they have been shipped to Belgium yesterday, and I have to pick them up in Belgium, or Robert is going to pick them up in Belgium. Usually I heard the shipping takes 3 to 4 days, so probably somewhere this weekend or next week on Thursday he can go get the phages. And I can't wait, because my energy is lower, and again, I have more flare-ups than when I was on the phages. But this is very different per person, because I know there are people who take phages for 3 months and then for them it's done. They are in remission. Since I've been having HS for 20 years with very severe intensity and getting more severe like every year, for me it's pretty logical. I didn't expect to be in remission or anything. But now when I'm off the phages and having effects again, I'm noticing how severe my disease actually was. And I'm getting things back that I thought I didn't even remember that I had that. The stomach aches, for example, which are like almost constantly there. I was just used to them. That feeling was okay. I didn't feel really good, but that feeling was just something that I got used to. And now when it gets back, I'm like, oh, that is what it was. It was really like stomach pain all the time, nausea all the time, tiredness all the time. And this is not a normal tiredness. This is also the thing. It's not like you did something and then you're tired from it. This is like complete exhaustion from nothing, and it really feels like there's a heavy cloud over you constantly and on top of you, which makes your muscles like really burn all the time, and the fatigue is surreal. I sleep a lot at the moment, but other than that, some days I have some pain, but today is like 3 again. So the phages are still kind of made my system already better, even though I'm out of phages for 4 weeks now. A few days were rough because there was really inflammation, but again, it didn't really follow through with big heavy lumps or something. It was more painful for 1 day, and now I can touch everything and it's a little sore, but not that painful. So it's been really interesting to be off the phages, because now one of the things I noticed is what the phages did for me, which was a lot. Not only HS wise, but also, for example, I had like a gum problem. It was infected very easily. Everything got infected very easily with me. Some mouth sores, those were completely gone while being on phages, and now being off phages, the last week they are coming back again. Another thing I've been noticing is every time I got cuts on my fingers, so for example, I don't know if you can see it, I have a little cut on my thumb. While on phages, those just healed. Well, now it's a little bit infected. Not very heavily infected, but as you can see, it's pretty red around. So on phages, I don't have that it gets infected that easily. So now every cut and scrape gets infected again. So it really works against the inflammation for me. The same is with my hay fever. While being on phages, my hay fever was gone. And now I'm off phages for 4 weeks, and my hay fever, I'm constantly sneezing. So this is another thing that is so different while being on phages. So somehow the phages are really working against like any kind of inflammation in my body and making my body way more healthier, which is pretty interesting so far. And it's not like this is going to do that for everybody, because phages are just like any other medication. For some people it works, for others it doesn't. But it should be an option for people, because, well, I've been taking phages for 3 months without any side effects, and my mood was better. Everything was just better, and more energy. And so I can't wait to do another round of phages. I really hope that I get them soon. Of course, I will do another vlog about that as well. Another update is that today was the last appointment at the EMC. They have been following me for 12 weeks while being on phages, plus a baseline appointment in the beginning before I went to the Eliava, to see what the phages do on my microbiome, to see what the phages do on my HS. And of course, this is a one-patient study, but they are just really interested in this topic and interested in what phages can do for people with HS. So this has been very interesting too. They found it pretty interesting what was happening with me. They already said, yeah, we can see it's doing something, and how that works, and it doesn't really make any sense to them yet. They still have to review all the swabs that they did and the stool samples, but that will take a while, because they have to do that in batches of 400. And since they only took like 50 or 60 samples from me, it will take another study they are doing on the microbiome. All the swabs from that, they will combine it, and then they can do like a batch of 400 and use 16S sequencing for it, which is a microbiome research. They can view very precisely what kind of bacteria, what kind of phages, what kind of things are happening in the microbiome. They can view biofilms if they maybe were killed more, or they can view everything with the 16S sequencing, which is pretty interesting. It's different than a normal culture test that basically every doctor sometimes does with HS, not with every patient, but most of the time when you have your normal swabs taken, they are taken to a lab and checked cross-references through a lot of common bacteria. With 16S sequencing, this is different, and it's a more complicated way of reviewing swabs, and they find way more and get into detail way more. So that's pretty interesting. Let's continue where I left off. So I was telling that I notice things getting back. You can also see it in my face, getting more pimples again in my face while being off phages. But if I compare it to the first stop weeks, this is way better. Because in the first stop weeks, like when I was taking phages for only 20 days, I had my first stop weeks. Within a week, inflammations came back. And I couldn't start phages again because I was throwing up a lot because I had whooping cough at that time. So then I skipped the second stop weeks. And because I skipped them, my inflammations got so much better. I had like, for the first 2 weeks of my last stop week, I had like no flare-ups whatsoever. So it took 3 weeks to get flare-ups, 2.5 weeks to get like the fatigue again and joint pain. But flare-ups took like 3 weeks, which is pretty long for me of phages, because normally when I take antibiotics and I stop taking antibiotics, within like 3 days, the inflammations get back up again. It's horrible. So it's been pretty long time without inflammations. I actually had like almost 2 weeks where I was completely flare free, not one flare out there, which is I can't even remember the time that I had that. So yeah, that's been pretty interesting. So when I look at things like that, for me, phages are a solution at this point. Of course, we have to wait and see. How long does it take before maybe I build up some kind of resistance for phages, because that's possible, but it doesn't have to necessarily happen. It's just really different per person. I've been talking to scientists about this. There are people who take phages who build up resistance within a week, sometimes even within a day. And there are people who never build up resistance, who can take phages for years and never have resistance whatsoever. So yeah, it depends just on a lot of factors. What is pretty good is that the Eliava gives cocktails, which vary every time. So because they are cocktails, chances are like less that you will get any kind of resistance for it. So that's pretty good. And I was talking about the study. So they are going to review the samples as soon as they can. And then they are going to write something like a medical science journal or medical study transcripts about their findings. But what people need to know, because I've been getting loads of messages of people asking, well, you're part of a study. As soon as they know what is going on with you and if it's working, they will probably make it available. This is not how it goes, sadly enough, but also good enough, because this is also for safety reasons. So I'm just one person. I'm a one case study, which doesn't say a lot. It only says that as soon as they think it's interesting what is happening with me and that it's working, the only thing that it could say is, well, we are now very interested in doing more studies. That's the only thing that will come out of this study. But it's a start, because it's the first HS study, like clinical or like really scientifically a study that has phages, especially on HS, really checking the full microbiome, which makes it an interesting case, but that's all it is. It's not going to bring phages to the Netherlands. It's not going to bring phages on the market for more HS patients at this point. The only thing it does is it might awake the interest of the HS dermatologist to see if there are more studies possible, or to see if this could be something that could be available in the future for HS patients. But this takes a lot of time. So everybody who is interested in phage therapy and wants to try it out, the only chance within now and 10 to 20 years to get to use phages is to go to the Eliava or get phages from Georgia or Russia, or clinics that are already bringing phages available, because there's no other chance in the Netherlands to get phages. In the USA, this is a different story. In the USA, they are already starting up trials, so this goes a little bit faster, but not for HS yet. But what is important, that if you guys want phages and want to try out phages, is go to your doctors and ask them, I want to try out phages. Can we make phages available? Because the more people that ask their doctors, the more people in your family you tell about phages, the more buzz there will be, the more interest there will be from pharmaceutical companies, the more interest there will be from governments to fund trials. And this is one of the reasons I'm making vlogs and I'm still sharing my story with everybody. Is because when I can just accept that phages are working for me and stay in my home and be very happy and more healthy, but that only does good for me. And I feel this is very important to bring phage therapy to HS patients, to at least try, and to be covered by health insurance companies. And I believe this is the future. I think we will get there. It will take time, but it will go faster if everybody starts asking their doctors about phage therapy, because it will interest them. And the more buzz there is about this, the easier it is to start up the studies. So everybody who wants to help, the best thing you can do is ask your doctor about phages, if phages are an option for you or your HS. So yeah, that was my update. So I'm doing pretty well. Today I will be going to we have like a little cabin in the forest. I will go there for 5 weeks, and of course I will vlog, because I will get my new phages, and I will get all results maybe with that, because I'm getting new phages as well. I'm going to share how those taste, because I heard from people those have the worst taste of all the phages the Eliava gives. So I'm going to share that with you, and I will do updates as many times as I can. So for now, wishing you all a lovely day, and hope to see you guys soon. Bye guys!